Today, let's talk about the 10 signs that will show your kidneys are already damaged. What is kidney failure? How are kidney issues diagnosed? Are kidney issues treatable? Stay till the end and we will tell you all you need to know. Kidney failure is also known as renal failure. It is a situation that can affect either one kidney or both. Kidney failures occur when the kidneys are unable to continue to carry out their functions. In some cases, this issue can be chronic, whereas in other cases, it can be a temporary condition. The onset of kidney failure can be sudden, or it can be a gradual reduction in kidney function. This is a severe condition that you should be concerned about. Now, let's look at what role our kidneys play. Though this bean-shaped organ may not look like much, it plays a vital role in our body. The main job of our kidneys is to eliminate toxins from our bodies. So, the kidneys filter out wastes and dispose of the wastes through urine. In case any issues arise in our kidneys, wastes are not removed and they remain in the body. At first, you may fall sick in case your kidney is not functioning properly, but later on, this can become life-threatening. In cases of renal failure, where only one kidney has been affected, it is possible for a person to live their lives with just one kidney. However, when both kidneys are affected, your only option is a kidney transplant or dialysis on a daily basis. Let us now discuss the 10 signs that show your kidneys are already damaged. The first sign is excessive tiredness. When there is a decrease in kidney function, the levels of toxins and wastes in our body build up. The first that is visible is excessive tiredness. People have also complained of feeling weak and having difficulties in concentration. The second sign is disturbances in our sleep. When the toxins are not disposed from our bodies, they stay in the bloodstream. This can cause you difficulties while sleeping. Researchers have observed that people with obesity were more likely to develop kidney conditions. In addition, sleep apnea was commonly reported by people with kidney issues. The third sign is changes to the condition of our skin. When the kidney starts to fail, your circulatory system is not able to ensure that the right amount of minerals are available. Dry skin is often a sign of kidney disease. The fourth sign is the urge to urinate frequently. When our kidneys are in poor condition, we feel the frequent urge to urinate. It can also be a sign of high blood pressure. The fifth sign you will notice is the presence of blood in your urine. This is an indication that the filtration system has been damaged and blood vessels are leaking into the urine. Under normal circumstances, your kidneys are able to separate the blood vessels, but in case their functioning is impaired, it becomes problematic. The sixth sign is that your urine may have a foamy look. It may require to be flushed several times before it goes away. The seventh sign is the presence of puffiness around the eye. This is due to the loss of proteins and minerals in the urine. The eighth sign is swelling around your ankles and feet. A reduction in kidney function can lead to increases in sodium retention. This leads to swelling in the extremities like the feet and ankles. Poor appetite is another sign. Since there is a buildup of toxins in your body due to reduced kidney function, it is possible for your appetite to decrease. The 10th sign of kidney failure is excessive cramping. Kidney failure is also linked with electrolyte imbalances in the body. In case the levels of calcium and phosphorus in your body are not optimal, it often leads to cramping. Now that we have looked at the 10 signs that you may have kidney damage, let us look at what the color of your urine will tell you about your health. So normally, we are used to seeing clear or pale yellow colored urine. But in case of kidney damage, the color of the urine can make things a bit evident. As stated before, clear or pale urine is a sign that you are drinking water and your body is hydrated. Urine should be this color most of the time. In case it has a dark yellowish or amber hue, it is usually a sign of dehydration. You should cut down on caffeine, nicotine, and alcohol and drink some more water. It is now that things get serious. In case your urine is orange-colored, it can indicate severe dehydration. But it can also be an indication of a more worrying condition, that is, there is bile in your urine. In situations where you notice that your urine is pink or red, it is possible that could be due to the presence of blood in your urine. Sometimes your urine could get this color in case you've eaten fruits or vegetables with reddish pigments like beetroots or strawberries. Lastly, foamy urine is a sign that there are proteins in your urine. In both these cases, you should consider visiting a doctor immediately. Now let's look at what causes kidney failure. The most common culprits behind kidney failure are severe dehydration, high blood pressure, liver disease, or diabetes. Other causes include autoimmune diseases and reactions to certain medicines. As we discussed before, kidney failure can happen suddenly or over a period of time. When the loss of function is over the span of a day or hours, it is referred to as acute kidney failure. The long-term degradation of your kidney due to a combination of high blood pressure and diabetes leads to chronic kidney disease. This chronic kidney disease then becomes kidney failure over a period of time. Let us now discuss some of the reasons behind chronic kidney failure. The first cause we will discuss is high blood sugar and diabetes. So, if your blood sugar levels remain high consistently for an extended period of time, it affects your internal organs, including the kidney. Similarly, in case you have high blood pressure, the blood travels through the blood vessels with high pressure. This increased pressure can have an impact on our kidneys. Over the long term, it causes damage to the tissues in our kidneys. There are a few other conditions like polycystic kidney disease, glomerular disease, lupus, and other autoimmune diseases. After hearing all this, you may be worried about your kidneys' health. So let's look at how you can determine the state of your kidneys and how kidney failure is diagnosed. Usually, doctors prescribe tests like urine analysis, urine volume measurements, and blood samples for this process. The first test we will discuss is urine analysis. This test is simple. It involves you giving a urine sample. Then a test is conducted to check if there is anything abnormal like protein or sugars in your urine. Checks may also be performed to find out if there are blood cells or bacteria in your urine. Another test is urine volume measurements. Here, the urine output is measured. In case a person has low urine output, then it is likely that they have kidney disease. Sometimes your doctor may ask you to give a blood sample. In this case, a test is administered to determine the levels of urea, nitrogen, and creatinine in your blood. In case there is an increase in these levels, it could be a sign of kidney failure. Your doctor may also order that you go for an MRI or CT scan of your abdominal area. This is done to identify any blockages or issues with your kidneys. In rare cases, your doctor may even conduct a kidney biopsy. Analysis of this tissue sample will often give an idea about any kidney damage. Now that we have talked about how kidney failure is diagnosed, let's look at how kidney failure can be treated. The first step that your doctor will probably take is to intensively monitor your blood pressure and kidney function. In the beginning, the focus will be on lifestyle changes and medication to help maintain kidney function as long as possible by delaying the progression of the disease. But after a point in time, these measures may not be enough. Then, the focus becomes to keep the patient alive as long as possible. The first method used is dialysis. This treatment involves using a dialysis machine to filter your blood. You may have to visit the dialysis center a few times a week or even daily. At present, you can perform dialysis at home also using a dialysis solution. The next step is usually a kidney transplant, where a person donates a kidney to you. This new kidney takes over for your damaged kidneys. The issue with kidney transplants is that there is a long waiting list in most countries. In addition, you cannot buy a kidney as such. It has to be donated by a third party to you, so this adds to the challenge. Now that we have an idea of the treatment for kidney failure, let us look at how we can prevent this from happening in the first place. Keep in mind that kidney failure cannot be reversed. However, you can prolong the life of your kidney through healthy habits and lifestyle changes. The first thing is to keep a close and regular check on your kidney function and blood pressure. Then, you have to ensure that your blood sugar levels and blood pressure levels remain under control. You will have to quit drinking alcohol, smoking cigarettes, and consuming other tobacco products. Your diet will have to change to reduce the intake of fatty foods, oils, salt, and proteins. Finally, you need to ensure that you take medical advice at the earliest. You may be consulting a general physician in normal circumstances, but when it comes to your kidney, you will have to pay a visit to the nephrologist. Nephrologists are trained kidney experts who would be able to evaluate your condition and help you in this situation. And that's all we have. We have discussed the 10 signs that show your kidneys are damaged. What do you do to stay healthy? Have you changed your diet to maintain your health? Let us know your thoughts in the comments.